Hello and welcome. Today I thought we'd talk about obesity, a major global problem. In fact, since 1975, obesity has tripled in the world. Some statistics: 2016, 1.9 billion adults were overweight. Of these, 650 million obese. So that's a significant problem. What has caused this? Well, first, there's lifestyle. There's the food that we eat. We're eating more processed food. We're eating more sugars. We're less active. We have a more sedentary lifestyle. So these are obviously major factors. Not only that, but maybe because of our diet or whatever, once you become obese, your metabolism can change, which makes it even more difficult to lose weight. Some other interesting factors that have been discovered lately as a cause of obesity is the intestinal microflora. It turns out that the bacteria in your gut, which you need, also helps you stay healthy. If you're obese, chances are that the number of different bacteria is much decreased, and that somehow may also affect your cravings for food. If you have a less of a bacterial count or a different type of bacterial count, then your cravings for certain food, especially what we call junk food, is going to be higher. Whereas if you have a more healthy gut flora, not only are you going to be able to lose weight easier, but also some of these cravings are not going to be around. So that's one other very interesting factor. How do we describe or how do we classify obesity? If your body mass index, what's body mass index? Well, we take your weight, we take your height, and there's a formula that comes out of it. And if this is over 30, we consider that person as obese. If they're over 40, then they're morbidly obese. In other words, very obese. Between 27, 28, and 30, you're kind of overweight. And if you're 25 and less, then you're good. So that's the classification. Well, what do you do for treatment? First, lifestyle change. In other words, the foods that you eat, your activity level. These are all issues that need to be addressed. Also, we want to make sure that there's no other contributing factor. For example, your thyroid. If your thyroid is not functioning well, that can affect everything in your body, including also make you gain weight. And you also want to make sure there are not other associated factors, because with obesity comes a whole host of disorders. There's type 2 diabetes mellitus, there's coronary artery disease, another heart condition, there's ischemic heart disease, there's hypertension. You become more prone to getting all types of cancer, inflammatory disorders, and so forth. So along with obesity comes a whole host of different disorders. So when you treat obesity, not only do you treat the presentation and the visual aspect of the patient, but you're also helping to prevent and hopefully, if this is already established, get rid of a whole host of disorders. What can you do? Well, like we said, lifestyle, your dietary intake. But if these fail, so if you have somebody with a body mass index, like we said, of over 30, and they've tried conservative therapy, which is always the first step, then you need to move on to something else. Well, what can you do? There's certain medications that may help. There's surgery. In the past, they used to put a band over the stomach, which is not really done anymore. There's a sleeve gastrostomy. In other words, surgically, the stomach is made to be smaller. You can do a bypass. That's more for the morbid obese patient. In other words, you just bypass the stomach and you move the esophagus into the small bowel. And somehow the body adapts to this. It's a more radical procedure, but it can be done. You could actually do an evacuation procedure. It sounds crazy, but it works. In other words, you put a tube into the stomach and connected to a device, nobody sees it. And about half an hour after the person eats, they go to the washroom and they evacuate their about a third of their meal. This also provides biofeedback, so they see what they've eaten, if there's been something bad or whatever, and it really makes them eat healthier and makes them lose weight. But a lot of people just don't want to get into that, which is obviously understandable. But that's another treatment. There is one other treatment which is growing extensively around the world. That's called endoscopic sleeve gastroplasty. And basically what you're doing is you're making the stomach smaller endoscopically. So with a light, you go into the stomach and you put stitches. And the good thing about this is that not only do you make the stomach smaller, but you also allow small pockets to make the sensation of fullness. So there's more of a satiety. The complication risk, because you're not cutting anything, is less than 1%, and that's usually just minor complications, versus surgical, where it can be quite substantial, depending on where it's done. And you have the exact same results with much less risk of a complication or morbidity, and there's no cutting, and the patient is sent home the same day. In fact, it's a 1-hour procedure. Treatment modality is placing balloons in the stomach. So the initial balloons were not as effective really as the present day ones. Present day ones are good. The good thing about it is that you put it endoscopically. It doesn't really take that long, but you have to remove it after 6 months. We usually prefer to put balloons in patients with a body mass index between 28 and 32. If you're really higher than that, balloons don't work as well. Unless if you're morbidly obese and you want to bring down that patient's weight prior to doing an endoscopic sleeve gastroplasty like we just placed, that we mentioned, or some sort of a surgical procedure. Like I said, the newer balloons are more effective. The problem is that after it's removed in 6 months, the patient has to be strict on their diet, so they need close follow-up to make sure that they don't regain the weight that they lost. So these are basically some of the issues on obesity, and hopefully in the later presentations we can touch on these in more detail. So have a great day.